Good afternoon. I'm DJ Wells of the Urban Health Program at the University of Illinois at Chicago, and you're watching the Urban Health Hotline, where each week you have a chance to call in and have your questions answered about important things that are going on in the world of healthcare, about all of the educational opportunities that are available for you in healthcare at the University of Illinois at Chicago, and also about some of the things that are happening just in the community as it relates to education and healthcare. Remember, this is a call-in show. It's your show. If you've got questions about anything that we're talking about, be sure that you call in. Use the call-in number that's there at the bottom of your screen, 312-738-1060. You can call in now. The phone lines are open. I'm joined today by Ms. Linda Casanova Pineda, who works in the Urban Health Program office at UIC's School of Public Health. She's responsible for recruiting Urban Health Program students for the college, for the School of Public Health. And a little later in the show, we'll be joined by a couple of Urban Health Program students, current students, who can tell us what it's like to be a student in the School of Public Health and a few other exciting things that are going on over there. Linda, thanks for being with us today.
Thank you for having me.
So, Linda, our regular viewers have heard a lot about the various healthcare careers that are available. They've heard from folks in nursing and pharmacy and the like. What kind of careers are we talking about when someone says they're going to school in public health? What kinds of job opportunities are out there for people who get a degree in public health?
Mm-hmm. Let me start off by saying that we all take advantage of public health, and it's around us all the time.
Mm-hmm.
We just don't see it because it's not a tangible. It's not something you could say, I'm a dentist, I'm a doctor, but doctors and dentists do practice public health.
Mm-hmm.
Public health is to make people safe, make sure that they are being, safe in their environment and in their healthcare needs,
mm-hmm.
and even in their food and where they work at. That is what public health is. What kind of careers can people have in public health? There's a myriad of things that they can do. People who start in the School of Public Health at the master's level and have straight out of college may find a job in, let's say, a community health advocate, mm-hmm. or a community health organizer, or a public health advocate within the community, or let's say in the environmental sector, or in epidemiology,
Sure.
or in health policy and administration. We have students who come in straight in from college, to people who already have a professional degree, who are already MDs practicing, medicine, and they feel that they need that component of public health. Or people who are doing some kind of research and they want to go into epidemiology to have formal education in that. There's many jobs within the federal government, state government, and local government where people can get it, but also non-for-profit clinics in hospital settings and environments. So when you say public health, people really don't know what it is, but we all benefit from public health.
Absolutely. I've heard other people describe it as I'm treating a population as opposed to mm-hmm. an individual patient.
That is correct. You treat the community as a whole versus being a clinician treating someone on a one-to-one basis. So it has many different explanations of what is public health, but we all benefit from it.
Sure. And we'll have a couple of your students
mm-hmm.
here a little bit later, and I heard you use a big word, epidemiology.
Oh yeah, that's a big word. That's something that took me a while, and that's why I like to show it off. It's the study of disease and why things happen. So we do have a student here who is a student in epidemiology who will be able to give you a better version of what epidemiology is.
Great. We look forward to
mm-hmm.
that. Linda, let's talk a little bit about your area of focus, the Urban Health Program, and some of the things that you're doing to recruit a diverse student population into public health. I'm going to jump ahead and ask, why is that important first? And then you can tell me a little bit about what you're doing to actually make it happen. But why is it important that we have a diverse student population in public health? Why do we need Blacks, Latinos, Native Americans practicing public health specifically?
Well, it's been known, and it's a fact, that people in our population in the United States, Latinos and African Americans and Native Americans, it's a large population that's being underserved.
Mm-hmm.
When people they feel more comfortable when they see a healthcare professional or someone in public health who they can relate to, where they don't have to explain the cultural norms
Sure.
or why things are being practiced within their household, because people already are comfortable in knowing that this person already knows about it,
mm-hmm.
or they can relate to them a little bit more because they're a person who happens to be Latino, African American, or Native American.
Sure. So what kinds of things are you doing through the Urban Health Program to recruit those types of students who have that cultural competency, who understand people's cultures and backgrounds? How are you recruiting those kinds of folks into the degree programs so that they can become public health practitioners?
Within the School of Public Health, we're the Urban Health and Diversity Program Office. We look at different things. Our focus is to recruit Latinos, African Americans, and Native Americans. We do a lot of research, a lot of networking where we know where there's a large concentration of Latinos, African Americans, or Native American students. Just yesterday, I went to the American Indian Center on Wilson Avenue here in Chicago, just to let them know who I am, to place the face and the name together.
Sure.
And that way we can bring in more and foster a relationship where we can bring in more Native Americans into our programs.
Absolutely. I know that you've got a couple of activities that you've got coming up. Some like summer programs that you engage in, and some conferences and those types of things. Tell us a little bit about those activities, especially for the students before they come to college.
We have several different events coming up on October 16th, Saturday, October 16th from 8:30 to 2:30 at the School of Public Health. We will be holding our biannual articulation conference. It's to recruit more Latinos and African Americans and Native Americans into the School of Public Health. It's an informational conference where we'll have a panel of students, the 4 division directors, as well as how to get into the School of Public Health. What can you do to make your application attractive, as well as the GRE, the Graduate Records Examinations. We do offer a Kaplan course, and we subsidize most of the tuition, and it's starting October 9th, and it's $325. But that way the student can get a head start and a jump start, so they just don't go in to get the GRE and not score a competitive score.
Sure.
In addition to that,
can I just cut you off for a second, just so our viewers know, the GRE is the Graduate
Records Examination.
So that's the entrance exam for graduate school.
It's one of the components that you need for graduate school.
Sure.
And in addition to that, we offer the Summer Residential Enrichment Program, and the application will be posted on our website. It's for students who have 60 semester hours or more and are interested in finding out about public health, or if they already know about public health, so they can get kind of a jump start and find out how they can apply to the School of Public Health, as well as to learn about epidemiology, biostats, what public health professionals do. And it's an 8-week course. We do provide a stipend for students, so they are not worried about money, and they're more than welcome to apply. We're taking applications starting the end of September.
Okay. Now, once a student actually comes to UIC and they're a public health student enrolled in the college, I know there's a number of things that are going on that support those students to make sure that they're successful. Can you tell us a little bit about some of those things?
Once students are accepted into the School of Public Health, we have what is called the pre-matriculation program. We extend an invitation to 12 students to come in 6 weeks before classes start to get a jump start on their course studies. They get an introduction to public health, they get an epidemiology and biostats course, as well as start to get a head start in finding out how they can get an assistantship, which we call graduate research or teaching assistantships, where their tuition is taken care of and they're provided a monthly stipend.
Okay. Any other things? I know we have the annual health professions conference, and that's an entire UHP event that the School of Public Health is a part of. But what other things are you doing for students once they're there?
We encourage students to network, to participate in different conferences and workshops that are available to them. In addition to that, we provide them with information on scholarships. We also provide them with letters of recommendations that they sometimes need in order to get that, for their scholarship. And we offer workshops on how to do a good resume, where they're a strong, attractive candidate for the positions. And we have a career advisor there who also offers advising to them on how they can perfect their resume, as well as how they can get networking opportunities and job opportunities.
Outstanding. It sounds like we're taking good care of our School of Public Health students.
Yes, we are. We try to.
Outstanding. Well, let's talk to one of those public health students. Thank you so much for being with us today, Linda.